Health and Welfare. Good to see everyone here this morning. The chair will be in shortly, but I'm going to go ahead and get the ball rolling as we do have a full agenda this morning. We will start with the hearing on House Bill 2754. We'll open that hearing with a bill overview by our staff revisor, Jenna Moyer.
Good morning, Madam Vice Chair, committee members. House Bill 2754 comes to us from the Committee on Judiciary and would authorize counties to use home rule powers to exempt themselves from conducting school sanitary inspections. It amends two sections. The first of those is KSA 19101A, and that is the statute related to the power of counties to exempt themselves from certain legislation. And this would be known, what is known as home rule authority. Current law in subsection A39, which would be on page 4 of the bill, provides that counties may not exempt themselves or affect changes to KSA 65201 and 65202. This would allow counties to opt out of all the provisions of 65202 except for subsection C of that statute. Section 2 amends KSA 65202, and that relates to local health officers. Current law provides that the local health officer shall, upon the opening of the fall school term, make a sanitary inspection of each school building and grounds, and shall make additional inspections as are necessary to protect the health of the students in the school. This bill makes that paragraph its own subsection, subsection C, and it allows for the reference in KSA 19101A to operate to allow counties to opt out of this requirement for the local health officer to provide a sanitary inspections for schools. House Bill 2754 passed out of the committee, the House, on a vote of 14 to 5. It would become law effective on publication of statute book, which is July 1st. I'll be happy to answer questions.
Committee, what questions do we have for the revisor? Seeing none, thank you so much. We will move to proponent testimony, and we are limiting verbal testimony today to 2 minutes so that we get through both hearings. And we'll start with Randy Bowman, Executive Director, KALHD. Welcome to committee.
Good morning, Chair, Vice Chair, members of the committee. Thank you. Again, I'm Randy Bowman. I'm the Executive Director of the Kansas Association of Local Health Departments. And just here is an opportunity this morning to represent our 100 health departments from across the state of Kansas on this matter that appears pretty simple and easy to resolve, I hope, for you as a committee to move this forward. But as I've heard it described by others, because I was not in this role or monitoring this work when this happened a few years ago, but it sounds like the general consensus is that there was a certain intent and discussion around some of the other changes that happened when this occurred. But this paragraph, what is now paragraph C, was a little bit of on the House side that described it as an unintended consequence. That didn't really need to have more levels of government, more governmental organizations involved in school activities. So my understanding of this piece of legislation, it would allow the county commissions to exempt themselves out of this oversight role of these inspections of schools, would still allow them to do that if they chose not to exempt themselves out of that. So I think it's restoring some decision-making to our boards of county commissioners. Our health departments are supportive of that, and I'd appreciate your passage of this bill at the appropriate time, and I can stand for questions.
Thank you, Madam Vice Chair, for taking over for me this morning. And committee, do we have any questions for Randy? Senator Alley.
Thank you, Madam Chair. Thank you for being here. Who does the inspections?
So currently it would be the staff of the local health department in most of your health departments, because that's 2 or 3 or 4 people. It's going to be even the director themselves in a lot of those.
Okay, thank you.
You bet.
Additional questions? Seeing none, thank you very much. Closes the hearing on 7554. And we will now move to opening the hearing on House Bill 2749. And may we have a revisor's brief?
Thank you, Madam Chair, committee members. House Bill 2749 requires medical care facilities and providers to report reasons for each abortion performed at those medical care facilities or by the provider to the Secretary of Health and Environment. Section 1, and there's only one section in the bill, it amends KSA 65445, and that statute currently requires medical care facilities to keep certain records on all lawfully terminated pregnancies and submit an annual report with the required reporting information. Subsection C, which is on page 2 of the bill, it would require each patient who seeks a termination of a pregnancy, except in the case of a medical emergency, to be asked which reason of the listed 11 reasons was the most important in that patient's decision to seek an abortion. The options include factors like interfering with education or career, inability to provide for a child, already having too many children, pressure from a husband or partner, the pregnancy being the result of rape or incest, and the pregnancy threatening the patient's physical or mental health. And the complete list of those factors is on page 2, lines 8 through 34. And if the patient declines to answer, that response shall be included. Subsection D requires the report to include the number of times each response listed of those 11, and subsection C was described as the most important factor, and the number of times the patient was asked but declined to answer. Excuse me. Subsection E would require certain demographic information to be collected on each patient, including age, marital status, residence, level of education, whether the patient previously had received financial assistance, reports of domestic violence in the last 12 months, and the method of abortion. The House Committee on Health and Human Services adopted amendments changing the term woman to patient, which would align with the rest of the statute using the phrase patient. It struck 5 of the reasons offered as options in subsection C, and also removed direction for the patient to rank the second and third most important reasons, so it would just be the most important reasons selected by the patient. House Bill 2749 passed the House on a vote of 81 to 39, and it would become effective upon publication in the statute book, which is July 1st. I'll be happy to answer any questions.
Committee questions for Jenna. Senator Alley.
Thank you, Madam Chair. I'm a little confused, but maybe I'll go look on page 3. I noticed above we've changed woman to patient on wherever it is in the bill. But on page 3, on line 14, they missed one. They said supports pregnant women.
Yes, and I believe that was left intentionally because it is a nonprofit organization that supports pregnant women. If we were to change that to one that just supported patients, it might be kind of confusing, just referencing that specific organization. I believe that there's specific organizations they have in mind that support pregnant women, and because this is separate from when the woman is the patient, you wouldn't have to be a patient to,
But
that
you
makes
do have
sense.
a support pregnant patient. You could have pregnant.
Yes, it could be, but you would not be required to be a patient receiving an abortion to receive services from these nonprofit organizations. So the nonprofit organizations, they support pregnant people, not just people seeking abortions, making them patients, if that makes sense.
Senator Petty.
Thank you, Madam Chair. Jenna, I just want to be clear. So now, as the bill's been amended, it seemed to imply that there had to be a ranking. And is that no longer in place?
Correct. The bill as originally written would have required a patient to rank the first, second, and third most important options, and as amended by the House Committee, just one reason would be selected, presumably the most important reason for seeking the abortion.
So, so when it says which of the following reasons was the most important factor in such decision to seek an abortion, so that would be what would be said to the patient.
It would not require to be said, but the question would be required to be asked, so it could be on a form. I imagine that would be the most time efficient for a medical care facility to present a form, a paperwork to fill out, and they would just check a box or fill in a circle.
And following up on that, and then, but the fact that there would not have to be, or you said that there would not have to be any reason selected. How is that clarified to the patient?
There is nothing in the bill that would require like a box to say, I don't want to fill this form out. But if a woman would not, by law, be required to fill this form out, there's no requirement that you have to check a box in order to receive that medical care. You could just hand it back and say, no, thank you. But that procedure's not in the bill of how a woman would choose to not answer the question.
So what is in the bill is that this form would be, that it would be required to be given to the patient, but with these items listed, and with the request of reasons for the most important factor in the decision to seek an abortion, but yet there would not be any in that list that would say you do not have to fill out this form.
Correct. This bill has a requirement on the medical care facility to ask the question, give the form, and then if the woman chooses to answer, they notate that in the report, or if the woman chooses not to answer, they would notate that in the report.
But the bill does allow not to fill out the form, but it doesn't have it on the form.
Correct.
Thank you.
Senator Stephan.
Thank you. Would you be kind enough to explain the reasoning behind the change from women to patient again, please?
Yes, if you look to the rest of the bill, it uses the term already, patient, like the subsection E, the bill already said patient age, patient's marital status, in addition to the existing language in other places in the statute to begin with requires the person to be referred to as a patient. So it would make it the same throughout the statute.
Jenna, thank you very much. Committee, we have allotted about 17 minutes for this bill. We have 2 minutes per conferee and a few minutes for us to ask questions, and then we must get on to the 4 bills on which we need to take final action. We'll begin with Jeannie Godden.
Good morning, Chairwoman Gossage, members of the committee. I'm Jean Gowden, Director of Government Relations with Kansans for Life, and I appreciate the opportunity to speak in support of House Bill 2749. The Kansas Department of Health and Environment already collects statistics from abortionists and abortion facilities and has for decades. And I have included as part of my testimony the most recent report from 2022, and you can see in there, that's considered attachment A, you can see in there the data that they collect, the different statistics. Starting on page 3, you'll have the age groups of the patients, then you will have the populations of the patients, the methods of abortion, all those types of things. And in addition, there is also the paper reporting form for the facilities and the abortionists, which actually these reports can be filed online once a year. But this just shows you the form that the abortionist fills out. Any of this information, of course, is part of the current regular patient medical intake process. When they do come to the abortion facility for an abortion, they are asked all of this information already. What we're adding to this particular gathering of statistics is the reasons why women are having an abortion. And the most widely used information data on the reasons is from the Guttmacher Institute back in 2004. And Guttmacher, which is an abortion advocacy organization, states that understanding women's reasons for having abortions can inform public debate and policy regarding abortion and unwanted pregnancy. Demographic changes over the last 2 decades, highlight the need for a reassessment of why women decide to have abortions, and we agree with that. But while abortion supporters are happy with the data collection from the Guttmacher Institutes, legislators should not have to rely on that information when making public policy decisions. So does that mean I'm finished? Okay.
It does. I'm sorry.
No, that's okay. I just want to draw
There'll
your
be time for
attention
questions.
to my testimony where I delve further into what is already being collected by the KDHE and what is also being done by the abortion industry in terms of patient privacy. Thank you.
Brittany Jones.
Good morning, committee, Chairwoman Gossage, and members of the committee. My name is Brittany Jones. I'm the Director of Policy and Engagement for Kansas Family Voice. We are supported by thousands of Kansans across the state who believe that women should be receiving support and that we should have accurate and timely information about what is happening to women when they receive abortions. And that is what HB 2749 does. It ensures that you have accurate information and can make wise policy decisions on best how to help women and to meet them where they are, but also to ensure that things are being done in a legal and safe way. And so we believe that this sort of reporting that we already have in Kansas that is largely in regulations that HB 2749 puts into statute will help further the information that you have, but most importantly, it ensures that you get it in a timely manner. Currently, these reports have been as long as 6 months late, which is long after you guys are out of session, and it is very difficult to ensure that we are making the best policy decisions based on late information. We know that the abortion industry already has this information, as they've already reported for the first half of last year, but to their own organizations, and this is not, the KDHE has not released that information as of today. And so HB 2749 would ensure that you had this information while you were still in session. And so we believe that this is information that this body deserves to have and the public deserves to have. We also know that there are many other states that are already doing just what HB 2749 does, and it will promote women's health in the state and promote this body's ability to make wise policy decisions. I ask that you support HB 2749 when the time comes, and I stand ready for questions at the appropriate time. Thank you.
Thank you so much. Committee, that concludes the proponent testimony. Please draw your attention to a written only. Do we have any questions for the proponents? Senator Petty.
Thank you. This is a question for Brittany. Brittany, thanks for being here today. But I did hear you say in your testimony about how this legislation would verify for the legislature that we have that there's legal and safe information. But I'm trying to discern in this bill what deals with legal and safe.
Chairman Gossage, Senator Petty. Yes, so there is information in the report required about how far along a woman was, that sort of thing, which are part of the current guardrails we have around the abortion industry.
But that's nothing new.
Correct, but a lot of this information is a part of our regulations that's not necessarily laid out in the statute.
Correct, but there's nothing dealing with legal and safe information that's new in this bill.
I think that is an argument.
I mean, you made that statement, so I'm just asking you, what is new dealing with legal and safe in this bill?
So as far as I'm aware, and I don't have the bill right in front of me at the moment, I apologize, but a lot of those specific types of procedures that are in the report are in the regulation, they're not in the statute.
Okay, thanks.
Additional questions, committee? Seeing none, thank you. Oh, Senator Holscher.
I'll go ahead and ask you, Brittany, if I may. I'm just curious, are there similar questions being asked of women carrying to term? Like, are we gathering that type of information?
Chairman Gossage, Senator Holscher. So there is a birth report that gets released by the KDHE every year, and there are similar things on that report. And I think I linked to that report in this testimony. I'm not 100% sure that I did. I know that I refer to it often, and it's very easy to find.
Thank you, Senator Thompson.
Thank you, Madam Chair. Probably Jeannie. Sit in the back there, Jean. I didn't see, I was just looking through the questionnaire of things that they ask. Was there, and maybe I missed it, religious, whether or not they are religious, whether or not they truly understand they're ending a life?
No, that's not something that the KDHE requires for abortion providers to submit. Now, different questions can be asked, and I know in the patient intake form by the abortionists themselves. I've seen different ones, and some of those do ask a person's particular religious beliefs, but that's not something that's required by the KDHE. It's purely statistics, the demographics, the population groups, all those different types of things that are asked by the KDHE. And currently, some of those, like we said, are being asked already in rules and regs, but we're putting them into statute is what the difference with this bill is.
Thank you. And we're going to move to our opponent testimony, and we'll start with Selena Sandoval.
Good morning. Thank you to the committee for allowing me to be here today. I'm Dr. Selena Sandoval. I use she, her pronouns, and I'm proud to serve Kansans as the Associate Medical Director of Planned Parenthood Great Plains, or PPGP. PPGP offers expert, compassionate, and comprehensive sexual and reproductive health care to patients with 3 health centers located in the great state of Kansas. As an OBGYN who provides abortion care for Kansans, I'm here today to make it clear that HB 2749 would severely harm patients and is not in alignment with best medical practices. This bill would require providers to ask patients about the reasons they're seeking abortion care from a list of 11 legislatively outlined reasons. Providers would also be required to report this information to KDHE. This is not only medically unnecessary, but it intentionally exposes patients' personal lives to the wills of politicians who have never actually met them. This bill is motivated by anti-abortion stigma and a desire to harass, intimidate, and shame healthcare providers and patients in Kansas. It directly ignores the will of Kansans who have made it clear that they do not want politicians in their exam rooms. Requiring abortion providers to ask such invasive questions of patients serves no purpose except to shame and stigmatize abortion. The reporting requirements set forth in this bill would undermine the patient-provider relationship and present serious barriers to honest conversations about care. The ability to have open and truthful conversations is a fundamental element of the patient-provider relationship. Patients should not have to fear that they will get denied care for not knowing how to answer a question. Healthcare is not a standardized test, it's basic human right. The American College of Obstetricians and Gynecologists has repeatedly reaffirmed their strong opposition to any government interference that threatens communication between patients and their physicians or causes a physician to compromise his or her medical judgment when caring for patients. There is simply no medical reason why I or any provider would need this information to adequately care for patients. It does not protect current or future patients. Kansans have made it abundantly clear that abortion access is a right that should not be impeded by legislature. I strongly urge the committee to oppose HB 2749 for the health and safety of our communities. Thank you.
Thank you. And next we have Sarah Manns.
Thank you, Madam Chair. I'm Sarah Manns. I'm a researcher who works in the area of abortion decision-making and choice. I recently conducted a survey of Kansas abortion patients about their experiences, and this bill jumped out at me, and I came here to talk a little bit about the bill because I was concerned. In order for me to conduct that research, I had to go to the monitoring body at my academic institution and a group of people who are experts in how we do good science, how we make sure that the questions we're asking are closely fitted to the information we're trying to derive, and that the data we get is going to be strong and solid and something that we can really analyze and base policy on. The board just monitors the design of the study to make sure that while I'm looking for that information, which I want because I'm a researcher, that I'm treating patients with dignity and respect, that I'm treating all of my subjects as people who have decided freely to participate in that research. There's an informed consent process that happens before someone decides to get into this data set, right? With her most personal, I mean, some of these questions are very invasive, her most personal information about what's happening for her. Informed consent, though, isn't a form, it's a process. And we have a monitoring board, the Institutional Review Board, that looks over our study design to make sure that we're not going to cause distress in the subject, that we have a plan for what we'll do if we do distress a subject, if they experience some really difficult feelings coming around from talking about these things, and that they really understand what will happen with their information. Where is it going to go? Who will have access to it? That process takes a long time. And that's one of the reasons that the research that one of the other witnesses was calling for from 2004, it's taken years for that research to happen. But the great news is we now have those answers. So we don't have to be concerned about the gap between what's outlined in this bill, which is a form in the doctor's office.
Thank you, Jessica. I'm sorry your 2 minutes is up, but thank you for your testimony. In committee, I would direct your attention to the written testimony. I know we have a couple of minutes for questions. Questions for our conferees.
Miss one?
Oh, did I miss one? Yes. I apologize. I am so sorry. Jessica Wanamaker. I checked it off prematurely. Forgive me for overlooking you.
Good morning, everyone. And you said my last name correct. Thank you. Hello, everyone. My name is Jessica Wanamaker, and I am the Director of Clinic Operations at Trust Women in Wichita, Kansas. I'm honored to be here today to speak and to answer the committee's questions in regards to HB 2749. My healthcare background, I have worked extensively in all facets of reproductive healthcare, in OBGYN, infertility, and abortion care. I recently just relocated to Kansas from Florida, working as the health center manager at Planned Parenthood Southeast and North Florida in the Jacksonville, Florida location. In my experience as a healthcare worker, I have seen firsthand how intrusive and stigmatizing questions such as these negatively impact patients and disrupt the healthcare that they are seeking. In 2021, Florida required 8 questions abortion performed due to the following: social economic reasons, emotional, psychological health of the mother, physical health of the mother, not life-threatening, life-endangering condition, serious fetal genetic defect, deformity, or abnormality, incest or rape. In 2022, they expanded with 2 additional questions performed due to victim of human trafficking and fatal fetal abnormality. These questions and the questions presented on this bill harass innocent women by delving into someone's decision. This entails digging into circumstances that invade privacy of the patient, and some of these questions carry implied judgment on people's decisions and lives. All of these things work together to divert someone of making a choice, a free choice that was overwhelmingly voted on and protected by Kansans on August 2nd, 2022. The impact of these questions heighten and raise patients' emotions before, during, and after, trigger trauma, and create hardship for the patient and for the healthcare staff. Patients felt like they have to justify their decision, which contradicts our beliefs as healthcare providers. These questions threaten the sanctity and privacy of the physician-patient relationship. Providers felt these questions asked were invasive, not medically necessary, and did not promote patient confidentiality and patient autonomy.
Jessica, I'm sorry. I know you couldn't hear the timer, but your 2 minutes is up. Thank you so much.
Thank you.
And committee, we do again have a couple of minutes for questions. Are there questions for the conferees? Senator Stephan.
Thank you. I'll probably direct this towards Dr. Sandoval. I'm working under the assumption, and I would like for you to verify my assumption, that we all would love to see the babies be born. And the concept that this data has no worth in an era where it's all about data and creating actionable items off the data, that this collection of data has no worth and is harmful escapes me. Can you help me understand how organizations or people couldn't use this data to come up with modalities by which to ensure that these babies are born? Thank you.
Yeah, thank you for that question. I mean, I think one of the big concerns is how the data is collected. So as Sarah Mann alluded to, this research and data has been readily available for us, and it was performed by experts in the field. But specifically and most importantly, their research practices underwent vigorous scrutiny from their respective research boards to ensure that ethical practices were performed and to confirm that the research was not involuntarily performed on vulnerable populations.
Committee, we have time for one more question. Senator O'Shea.
Thank you, Madam Chair. My question's for Dr. Salina. On the Planned Parenthood Great Plains, it has on its website as part of HIPAA fundraising activities. We may use health information about you to contact you in an effort to raise money for our not-for-profit operations. Can you speak to that?
Yeah, I could say confidently that we would not break HIPAA in order to obtain funding.
Committee, this concludes and closes the hearing on House Bill 2749. We will now open final action to continue from the recess that we took from yesterday on House Bill 2777. We will start with the amendment that Senator Petty had yesterday.
Thank you, Madam Chair. So the amendment is on page 1. It's in line, in section 1. And as you can see, it's been renumbered to be 1 and 2. So it basically would allow photographs to be, photographic images to be taken by the fire marshal during an inspection or investigation, and nothing else.
Eileen, why don't you just tell us?
Yeah, go ahead, Eileen.
Thank you, Madam Chair. We discussed yesterday audio being allowed or not, and as you see, audio has been struck again. I'm sorry, the stricken audio has been unstricken to remain a prohibition on using audio during an inspection.
Thank you for that, Eileen.
Do you have questions on the amendment? Senator Blasey.
Thank you, Madam Chair. Where is the audio being unstricken? No. Oh, it's a different page? So just clarifying then, a fire marshal's office can enter a building with a camera as long as it only takes still shots? Is that what this amendment does? Or is it just saying he may use a camera to take photos?
Eileen.
Thank you, Madam Chair. The amendment states that the fire marshal cannot take video or use audio during an inspection, but there is not a prohibition on the state fire marshal's ability to use, to take photographic images as evidentiary information during an inspection of any potential violation.
Senator Petty.
Thank you. And I think if you look at section 1, it has in there, which yesterday there was a little bit of a conversation about, that shall not wear or operate a body camera or other audio or video recording. So that is in the bill. This just allows for photographic.
Are you moving your amendment? Oh, we have a question. I'm sorry. Senator Alley.
Thank you, Madam Chair. Does this prohibit inspections using a body cam in a hospital?
Yes, it's any patient care facility.
Any patient care facility?
Let me look again.
Thank you.
Licensed care facility, excuse me. And it would, I'm going to have to look up one definition. Can you give me a minute, Senator?
While she's looking that one up, go ahead with your question, Senator Stephan.
She's going to have to multitask. My question is, there on page 1, line 8, shall not wear or operate a body camera. Okay, that helps. But then this amendment allows them to take photographs. So they just couldn't do it via a body camera. Is that a fair statement legalistically?
Thank you, Madam Chair. Let me get back to Senator Alley first. The definition of licensed care facility includes a medical care facility pursuant to 65-425, which does include hospitals. So no, they're not allowed in hospitals. And Senator Stephan, during an investigation, the state fire marshal or the investigators are not allowed to wear or use body cameras or audio equipment, but yes, they can take photographic still images of any violations discovered. So unless the violation involved a patient per se, I don't think this amendment contemplates any kind of invasion of privacy or such.
Thank you. Are you ready to move your amendment, Senator Petty?
I move my amendment.
Second? Second from Senator O'Shea. All in favor say aye. Aye. Opposed? The amendment has carried. We're back on the bill, 2777. Do we have additional amendments? Senator Thompson.
Thank you, Madam Chair. Actually, this is one I'm carrying on behalf of the fire marshal, so I'll have the reviser read it.
Thank you, Madam Chair. I'm not going to read the whole amendment because it's a little bit long, but this would add in a section of law, KSA 76-327 as Section 2, and it relates to membership of the Kansas Fire Service Training Commission. It's mostly technical amendments to make it more seamless and clear who appoints the 9 members, and it would allow, if you look to, it would be paragraph, well, it's currently 8 that's stricken, but it would be renumbered. It has the balloon to allow a member representing not only Kansas community college fire training, but also technical colleges that offer fire training, and then would amend the language, adding a member representing the Kansas Emergency Management Commission and a member representing the EMS Board, and it would and it would also add a member appointed by the President of the Senate, a member appointed by the Speaker of the House of the Representatives, and clean up language allowing designees for the state forester and the state forester or the state forester's office, as well as the state fire marshal's designee. And it would clean up the language relating to appointment and vacancies in the position. This would be in line with the current law and how we designate members of commissions and giving authority to the chair. This is also in line with current law. And the last change would be in subsection E. It adds the word eligible members receiving mileage, tolls, and parking as provided in KSA 75-3223. That statute makes only certain individuals eligible for compensation during a committee, specifically legislators, but members working for executive branch agencies or other state employment would not be eligible. And this, adding that word makes that clear. So this would add in a new section with cleanup in the Kansas Fire Service Training Commission statute.
Senator Thompson, do you wish to address your amendment?
Oh, this was just, again, the fire marshal looking at, as in his new capacity, looking for ways to clean things up and tighten it up, add a little bit of additional expertise to the board. And I would move my amendment unless there's.
I think we have discussion from Senator Blasey.
Thank you, Madam Chair. My question is, has this been a bill introduced in the legislature this session?
No, I don't believe so.
My hesitance is to add a huge subsection to the bill, which really changing its intent of the original bill without really diving in and studying all this and who's sitting on what. I think we've learned anything in this building. Committee membership matters, and I think I'll be opposing this amendment.
Jenna, would you clarify, this is all that the board or the commission is already in the current bill, is that right?
So the Kansas Fire Service Training Commission, this is an existing statute. The board already exists. It would just change some of the membership and add a member from the House and the Senate, and then allow designees to be on that board. But this exact statute is not already in the bill. So the current bill is all new language, and this would add in a statute.
Thank you for that clarification. So it's in statute, amending statute, but not currently in the bill. Thank you very much. Committee, other discussion? Seeing none, are you ready to move your amendment, Senator Thompson?
Yeah, I move my amendment, Madam Chair.
Do we have a second? Senator Alley, all those in favor say aye. Opposed? No. The noes have it. The amendment did not pass, and we are back on the bill. Do I hear do we have another amendment on this? Seeing none, do I hear a motion on the bill itself? Senator Petty.
Madam Chair, I make a motion that we move out House Bill 2277 as amended. 2777 as amended. Sorry.
Do I hear a second? Second, Senator Blasey. All in favor say aye. Aye. Opposed? This bill is passed. That closes the final action on 2777. We are moving to 2547. Do we have amendments on this? Senator Stephan?
Yes, I do have an amendment. Would you like me?
Go ahead.
I'm always concerned when we relieve legal responsibility from folks. You know, we've seen it federally with social media. We've seen it with vaccinations. We saw it with COVID in hospitals. It tends to lead to less supervision, less oversight, and more problems. And interestingly as well, schools already have liability protection. In fact, they have statutes, which I think Jenna could explain to us in much more detail, defining schools' liabilities. And what this amendment does, it just removes that liability waiver for people, school employees, et cetera, who administer this medication. This bill is incredibly well intended, but having laymen make snap diagnoses, there's more than just anaphylactic reactions. There's kids who develop Wolff-Parkinson-White. There's kids who develop spontaneous pneumothoraces, all of which could be confused with an anaphylactic reaction. And I think to just take such a narrow field of view that everything is an anaphylactic reaction and waive liability in regards to that is going to minimize training, minimize thinking, and maximize complications. So again, we strike the waiver of civil liability from the bill.
Discussion on the amendment committee? Senator Petty?
So what this amendment does is strike any person that's doing something good faith, rendering emergency care at the school. Is that correct? That whole section B?
Yeah, basically, because they're all going to be working under the auspices of the school, which already has existing liability policy and liability responsibility statutorily.
Any other questions, committee? Senator Blasey?
Is emergency care or treatment defined somewhere in statute today?
Jenna?
Thank you, Madam Chair. What the amendment would do is it would revert it to the current law regarding emergency care by healthcare providers, which is in KSA 652891. And in that section, it's not a definition, but it explains it's rendering emergency care or assistance at the scene of any emergency or accident, including treatment of a minor. And then it goes into a little more detail. So there's current law about emergency care by healthcare providers in an emergent medical situation.
Thank you. And one last question, Senator O'Shea.
Thank you, Madam Chair. Just a quick comment. This amendment appears to change the entire bill. So I would just want to have another hearing before even considering voting on this amendment. Thank you.
We do have an amendment before us. Senator Thompson?
Yeah, I think it's smart not to just give blanket liability in these situations. Because we are dealing with kids' health, and it makes sense to make people have a little bit of a pause before they just administer some medicine they don't understand the reaction. So I'm in full support of the amendment. Thank you, Madam Chair.
Do you move your amendment, Senator Stephan?
I do.
Okay, do we have a second? Senator Thompson. All in favor say aye.
Aye.
Opposed?
No.
So sounds like the noes have it.
Let's do a division, please.
Division, all right. All in favor, raise your hand. 4 opposed. Chair breaks the tie. So we'll probably work this out in committee or in conference committee as this came over as a House bill. I vote yes, I'm sorry. Now let's move to, that closes the final action. Oh, forgive me. Yes, we have an amendment, and you told me that. Forgive me, Senator Erickson. Go ahead.
So during the hearing, I brought up the question of who is providing the training, and it wasn't clear. I think the intent was that appropriate medical personnel would train the staff, but it wasn't clear. So all this amendment does is say that the training has to be provided by a school nurse, physician, or mid-level practitioner, and that's all this amendment does.
Questions about the amendment? Seeing none, you move your amendment?
I move my amendment.
All right, we have a second? The amendment passes. We are back on the bill. Do we have a motion regarding the bill? Senator Erickson has moved. Do we have a second?
As amended, Madam Chair, thank you.
Yes. Senator Thompson, and all in favor say aye. Aye. Opposed? The bill has passed, and we are moving on to a final action on House Bill 2579. And could you give us a short brief on that?
Thanks, Madam Chair. House Bill 2579 would allow emergency medical providers under the EMS board to administer or to dispense over-the-counter medication.
Minnie, do we have any amendments on this bill? Seeing none, do I have a motion on the bill? Senator Petty.
Madam Chair, I make an amendment, I may make a motion that we pass out House Bill 2547 favorably.
You've heard the motion. Do we have a second?
What one were you on?
2579.
Oh,
I thought that's what you said. I'm sorry.
No, I did not, because I said the wrong thing. I was looking at.
Good catch.
I make a motion that we pass out 2579 favorably.
Do we have a second? We have a second. All in favor say aye. Aye. Opposed? Senator Holscher. I'm sorry, we were worried about the second, so I didn't hear that. All in favor say aye. Opposed? The ayes have it, and House Bill 2579 has been passed favorably. Now we were going to open the final action on House Bill 2536. Do we have any amendments? We do not. Could you give us a brief on this bill?
Thanks, Madam Chair. The House Bill 2536 would add a sole legal permanency foundation or sole legal permanency as an option for kiddos in foster care as a permanency option in addition to the existing options for adoption or aging out of the system. So it would allow an individual or more than one individual to have most of the rights of a parent to provide guidance and support to a teenager in foster care.
Thank you. I did ask Tanya if she could come and give us a quick review. There was some concern during committee regarding the fiscal note. Could you share that with us, please?
Yes, thank you, Madam Chair and committee. The agency did have an opportunity to revise our fiscal note. It's my understanding that was submitted for the committee. I do have paper copies here today if folks need them. Thank you. There are two main revisions to the fiscal note after consideration of our initial fiscal note, which was when the bill was introduced in January. One of the categories that has been eliminated from the fiscal note is the inclusion of young persons subsidy who would have been adopted. It was a provision to have a parallel monthly assistance payment to youth who are adopted, age 16 and older. We do realize that's a policy consideration. It is not essential for this bill, and the agency could move that forward at a future date as a budget enhancement request, so that has been eliminated. The second change is we have been able to learn more since January regarding the state's Medicaid plan for young people, and we do believe that this population would be accepted and eligible underneath the current state plan, so all health care costs have been eliminated from the fiscal note. The effect is about a 75% reduction in the total fiscal cost. We also wanted to bring forward that what's not reflected in a fiscal note is the potential cost savings for this new permanency option. If this new permanency option would be able to pass favorably and go into effect, it's possible it could reduce the length of time in care for a young person by 6 months. That would reduce the foster care caseload. Over time, for example, by the 3rd year, the savings of 32 young people who would experience each 6 months less time in foster care would be about $800,000 savings, which by year 3 would mean that there would be a net zero cost to this program over time.
Thank you very much, Tanya. Committee, do I have a motion on 2536? Senator Stephan? Yes.
Okay, and this would be for that
Tanya?
lady who spoke, as well as for the reviser. Okay, as quick as I can, my understanding was that the real fiscal note piled up because of the benefits that would travel with the child who was adopted through the sole path was also being extended to all the kids being adopted through the regular path. That's where the real costs lie. That's not in the bill. We don't see in the bill that aspect of it. Is that correct?
He's saying we're not permitting that in this bill.
It has been eliminated from the fiscal note.
About from the bill. It's not in the bill.
It could be possible that a young person that would be legally free and thus might have adoption as an option could choose sole if that made sense for them and their sole family. So it could be possible for them to choose sole if adoption wasn't the best desired path for them.
And if I may, Tanya, Senator Stephan, in my discussions with the department, as she had shared, the comparison should be a child staying in foster care or not staying in foster care. And if they're out of foster care, then that actually is a savings to the state because it's more expensive for us to keep them in foster care than to go into the sole relationship. But what you're asking, I think, is that you in our discussion was regarding, are we going to be saying, that this cost, if somebody is going to, the cost would be extended to somebody who would be adopted as opposed to the independent 16 to 18-year-old that would go into sole, correct? And that is not that.
I don't think so.
Oh.
My understanding was in the original fiscal note that to adoption, which those kids didn't get all the additional benefits, that they were going to now get all the benefits. That was my understanding. And that was in the bill.
Yeah, there is nothing in the bill regarding the difference between adoption. It just gives the additional option for the sole option. Tanya?
Correct, the bill adds a new permanency goal. The fiscal note did have a provision, which is more of a policy provision, to create parallel benefits. But that was in the fiscal note. It is not in the bill. And it has now been eliminated in the revised fiscal note.
Rachel, do you have a comment real quickly before we vote? Identify yourself.
Thank you, Chairwoman Gossage and Senator Stephan, for the question. I just wanted to reiterate, I think you are stating it correctly, that the bill has no requirement for extended benefits for adoption. It was added in the original fiscal note and has now been removed. Thank you for the question.
Do we have a motion on the bill? Senator O'Shea.
I'd like to move that we pass 2536 favorably.
Do we have a second? Second from Senator Holster. All in favor say aye. The amendment has been approved, or no, there was no amendment. The bill has been approved. Committee, we did it in record time. So I'm sorry. I cannot. We're out of time. Thank you, committee. This concludes the final action on that Senate Bill 2536, and committee is adjourned.